In 2020, when the COVID-19 pandemic began its global spread, the densely populated capital city of Kinshasa in the Democratic Republic of Congo was expected to be heavily affected. Save the Children works in Kinshasa as well as the provinces of North and South Kivu. Without wasting time, Save the Children teams in Kinshasa and Goma started to use learnings from the recent Ebola humanitarian responses to develop an integrated COVID-19 response model. Drawing upon the operational footprint of existing development projects in health facilities, the team was able to assist with health, child protection, and psychosocial services. But how did they decide to develop and apply this integrated model?
The title for this project is Containing the Spread of COVID-19 and Mitigating the Impact of COVID-19 on the population of Shangu District, Kinshasa Province in DRC. My name is Dr. Clive Asiago Omoke. I am the Humanitarian Health Technical Advisor for Save the Children in Democratic Republic of Congo. For this particular project, we had integrated health, wash, and child protection. We chose to ensure that there is an integrated approach for this response. Was based, first of all, on the lessons we had learned from the 10th Ebola outbreak.
With a high rate of fatalities, Ebola is very dangerous.
The number of cases, nearly 2,000.
Very simple measures, we can control this epidemic.
When we did an analysis of how the pandemic might evolve in DRC, Kinshasa was, being the capital, was going to be one of the places which will be hit with majority of the cases. And we had a developmental program which was ongoing in Kinshasa. It had been ongoing for about 4 years. The program was focusing on adolescent sexual and reproductive health care. And it was covering 7 health zones across a population of almost 2 million people. So what we did was to integrate our emergency COVID-19 response into the ongoing developmental project. And this had the benefit of ensuring of that, because already we had community acceptance, we had a long-standing reputation in that community, and also good collaboration with the local health authorities, local political administrative figures, the local community leaders.
Let's have a quick look at their journey from planning to implementation. As COVID-19 started spreading globally, Save the Children's DRC senior management team met to discuss their response design. The team started drafting a plan based on the lessons learned from 10 Ebola outbreaks and decided to implement an integrated approach in 64 health facilities and community networks in Kinshasa, where the program director, Dr. Pierrot Mabella, was leading development projects. They incorporated sector-specific objectives, but integration expanded beyond sectors. Save the Children included research from global COVID-19 responses, but the socio-economic context of Kinshasa required a more localized approach. Save the Children started to integrate tools and templates from the previous Ebola responses, including a rapid needs assessment form, which was adapted to the COVID-19 context. Clive's team had secured funding to get the COVID-19 response started by utilizing Save the Children's own seed funds and funding from ongoing projects, saving time and efforts. The team then presented the response plan to the national authorities in Kinshasa, where Save the Children had a good working relationship and reputation with the Ministry of Health. The team, within a few months, managed to reach 104 health facilities with COVID-19 related support. The team trained health workers on psychosocial first aid and how to recognize, respond, and refer child abuse, and how to ensure schools and homes took preventive measures to protect children and adults from COVID-19. Clive's leadership, knowledge, and dedication was key to implementing an integrated COVID-19 response. His strategy included encouraging sectorial integration in daily activities, integrating old and new funding sources, utilizing development work to access areas with humanitarian needs.
So this kind of integration facilitated our work, and we were able to, achieve impact in terms of in terms of our response, which might not have been feasible if we were coming in, set up a parallel intervention.
Researching response models from global and local responses and using experience and lessons learned from the past. Save the Children's COVID-19 response in DRC not only provided for the continuation of essential health services, but also ensured communities had access to other critical services during an outbreak. For more information, please read the case study and see more information here.